Good morning, everyone. We are Group D1 and we will be discussing Justin's case. So looking at the first step of the IDEA framework, the main ethical issues we've identified in this case are informed and enlightened consent, autonomy, beneficence, and decision-making capacities. Here, an NG feeding tube was inserted, but it's unclear if informed consent was obtained, even though the patient retains decision-making capacities. We see the principles of autonomy and beneficence in opposition. In terms of patient profile, Justin is a 41-year-old male with progressive bulbar palsy, a motor neuron disorder. It is slow progressing and has no cure. Therefore, treatment aims to manage its symptoms. Justin has had an increased difficulty swallowing, weight loss, and has 2 ulcers. Moving on to individual and family preferences, Justin has expressed his desire to be comfortable and not have significant medical interventions. His mother had been requesting for the feeding tube since he was losing weight. His sister is involved in his care, and he is on good terms with his ex-wife and says his 2 children should stay with her. For more context, when Justin returned to the long-term care residence, the nurses were shocked and angry and accused his mother of manipulating his decision. As mentioned, it was unclear if consent was properly obtained for the NG tube. Justin's speech is impaired related to his illness, and he no longer speaks. Looking at evidence, in this scenario, there is no written documentation for advance directives. The standard of practice from the Civil Code of Quebec states that enlightened consent must be obtained, even if verbally. Research also shows that NG tubes are extraordinary treatment. Finally, actions must align with patients' expressed consent.
The main stakeholders in that case are obviously Justin, but also his mother and sister. His ex-wife and 2 children probably know some information about Justin's wishes. And finally, the healthcare team also has valuable knowledge. Here, we are facing an ethical dilemma and a possible violation. The relevant ethical principles are the autonomy of the patient, his dignity, the disclosure of important information that was maybe not said to Justin, also non-maleficence, family and patient-centered care, utility, so maximize the good and minimize the bad, and finally, patient's rights. To us, the most important ethical principles are autonomy and dignity. The patient's suffering will mainly be in his mind. Therefore, it is important to maximize his mental integrity by assuring that he will be comfortable with their care given and that he feels that his wishes are respected. Additional factors to consider are the laws guiding nurses in a dilemma like this. According to the CNA and OIIQ, nurses should act respectfully to the patient and family. Also, nurses have a duty to advocate for the patient and explain to Justin and his family the pros and cons of having a feeding tube.
Now it's time to explore the options. Option 1, removing the feeding tube. Benefits: may help with Justin's sense of demoralization and preserve his right to informed decision-making and autonomy. Harms: physiological limitations such as weight loss, decreased wound healing, and malnutrition, as well as lack of trust in regards to the healthcare professional's judgment. Option 2, keeping the feeding tube. Benefits: can increase comfort seeing as feeding tubes are used for symptom control. Justin also starts to gain weight back slowly. This can potentially increase prognosis and allow him to spend more time with his children. Harms: it could affect his mental health status and violate his dignity if his rights weren't fully respected. Option 3, reassess cognitive ability to make decisions and explore situation. Benefits: healthcare professionals can further understand what Justin considers a significant medical intervention. It can also increase patient autonomy and dignity. Harms: reestablishing communication and a therapeutic relationship may take some time. In the case of the most ethical option, it would be 3. It's most consistent with laws, policies, and previous court cases. It's consistent with the SPN values, as well as has the least amount of ethical harms and limitations.
The final step is to act on our decision. This would entail informing all stakeholders that the situation is going to be reassessed and we will act in accordance with Justin's wishes in the present moment. We will bring up the nursing team's concerns at an interprofessional team meeting and document these concerns as well as observations of patients' morale and daily attitudes in our charting. Our implementation plan involves advocating for an interprofessional team meeting in order to discuss the situation, where we would bring up concerns suggesting for a reassessment of the situation. We would take steps to reestablish the therapeutic relationship with the patient and acknowledge this has been a difficult time for him. We will also ensure the patient is fully aware of his rights. We would evaluate the patient's morale and status to see if our intervention succeeded in preserving his dignity and autonomy. We would also ask for feedback from the family to see if they feel included and respected in the decision. We will advocate for follow-up interprofessional meetings to evaluate the interventions and to also consider what can be changed to prevent a similar situation from happening in the future. The option also met the conditions of the framework. We believe our process empowers the patient by allowing participation and minimizing power differences, while publicity was addressed with transparent communication to all stakeholders. Our decision of reassessment allowed for revision and modification in case of new information coming to light. We are comfortable with the chosen option as it aligns with the legal and ethical frameworks identified. It allows staff to gain more insight on whether or not the patient was involved and respected in the decision, and empowers the patient in the care process. Through empowerment, we can increase autonomy and dignity. It also gives time for the patient to solidify his advanced directives and choose an appropriate delegate for future decision-making.